Hello everyone, and I welcome you all to a new episode of Spine Connect. Today, as the IT technology is growing, there is one more bigger problem which is growing is this back pain. It is not in Pune or India, it is worldwide. So today we will be discussing all these problems with our renowned surgeon Dr. Shailesh Hadgaonkar, who is an IT doctor, what I believe. He works on Saturdays so that IT people can come to his OPD and take all the solutions to their problems. Hello, sir.
Hi, Suraj. You rightly said because when I started way back my practice at that time, the days which I started was Tuesday, Thursday and Saturday. And Saturday was by default the day which I also grew up with the IT industry and the problems. More so that Pune or a lot of cities which have this sitting job profile, like bigger cities, metros or tier 2 cities or even smaller cities like banks, they're sitting for a long time.
Yes.
And this is becoming a big problem everywhere. Maybe because we Indians, we work a lot, we work a long time, not only 40 hours a week, we really work 50, 60, 70 hours a week.
Yes.
And that is giving a toll on your neck and lower back. And that's how the problems are increasing in younger age, mid-age and elderly, of course, for sure.
So, as you mentioned about the back pain and lower pain, first I want you to explain our viewers about the anatomy of spine in a very layman language that everyone understand how it is.
I think it's very important, and I thank you for arranging all this because I was not prepared for. This is a very important thing that every one of us should understand. What we normally call, this is the upper part of the body, torso. The spine is normally divided into three main parts. One is the neck, it's a cervical spine, the mid-back, the dorsal spine, and the lower back, the lumbar spine. If you see, the neck has got a C-shaped curvature, and this is a natural lordosis. The back is got a D-shaped curvature, and it's called as kyphosis or kyphotic curvature. And the lower back again has lordotic, a C-shaped curvature. And these are the natural curves of the spine. And the lowermost part, which is the sacrum and coccyx, again has got some amount of D-shaped curvature. So this is a very unique structure, and when we see patients, some of them come straight, they can't move, they can have stiffness in the neck, they can have stiffness in the back, oh, I can't move turn. And these patients we normally call, you have a spasm which is probably muscle spasm, which is leading to this straightening of the neck, changing the posture, and there are various reasons for it which we are going to discuss today.
So, sir, as we are discussing about the problem, what majority problems we have got from the OPDs plus our comment sections and everything. One is the lower back, neck pain, shoulder pain, and herniated disc. That's what we want to know, and your experience is also.
Yeah, I think rightly said, Suraj. This is the, if you zoom it, I just would like to show the exact structure to all our viewers. This is the disc in between. This is a bone. This bone is a vertebral body, what we normally call is a spinal body, and this is a disc in between. This is a shock absorber kind of a cushion, and therefore we can twist, turn and rotate our lower back, also our neck, turn and rotate, both sides we can do. These are the two things which can be done because of the soft discs and the joint which are there in the back of the spine. They are called as facet joints. Therefore, it's a mobile structure, but the mid-back has got the ribs, and the rib gives more stability. Therefore, this mid-back or dorsal spine is not much of a mobile zone. The neck and lower back is mobile. Therefore, you get a lot of disc issues in the neck and the lower back, what we normally call slip disc or sciatica pain or neck radiating pain. These are coming from the discs. Also, muscles fatigue pain, deficiency leading to fatigue, spasm and pain. Overwork or repetitive stretch coming on the muscle leading to mechanical back pain because of muscle fatigue. All these things can be there in the neck, mid-back and lower back. Back has got a very strong muscle structure support, but it needs to be given proper toning, just like your motorcycle or your car which needs appropriate servicing. Your body also needs good amount of servicing in terms of keeping it fit it needs some amount of regular activities like doing some yoga or some exercises, stretching. All these things are important to keep yourself upright and fit.
Sir, as we were discussing about the spine, as muscles and nerves are also one of the major factor in it. How we are all the muscular pain related to the nerves or the bone shape, everything like that? So we want to know about more.
No, I think it's a very, very valid and important question. So it's in most of the percentage of the patients, the problem is because of some amount of irritation to the nerves. It's not a major problem, but if the pain is persistent, if the pain is not settling, then it can lead to some amount of neuropathic or some amount of chronic pain. Or you tell that a patient tells us, I can't walk much, I need to stop in between. That's called as claudication because the nerve is getting tighter. The difficulty in walking is becoming more pronounced. If it's a disc in the neck, then you can get pain in the arms or clumsiness or tingling, numbness. All these are the classical features of a slip disc. When this happens, then you definitely need to get it investigated appropriately because the problems can be milder, moderate and severe. Severe problems, yes, definitely they need early attention, but you don't need to go to the severity level if you investigate and understand it earlier.
Sir, what are the factors which aggregates in all this pain because of the work life or the work structure, workplace
Correct.
being there?
Yeah, I think if you realize now we are sitting here, we are sitting comfortably. This is a chair and this is a table. Normally, because of this lockdown, people started working at home, and initially they didn't realize the importance of ergonomic. Ergonomics is very, very important. How you sit, how you place your table, how you place a chair, whether it has a very good stand support, it has a hand support, because all these things can really minutely change the way you work, and they can create a lot of stress on your muscles. The most important is you need to check the elbow height for the table. It should be appropriate. It should be very comfortable sitting. That's very, very important. Then you need to check the thigh, whether it is comfortable. There should be some space in between. If it is not, you need to raise the table. That's also important.
Right.
And it's a lot of people ask, doctor, should I keep a chair so that I can sit 90-90? As a normal human being, it's difficult for you to sit 90-90 all the time. You can relax a bit. But if your muscles are good, if your chair height, your leg height, if you have a good back support, sometimes someone can have some amount of more arch. So if you can keep some amount of arch support, the eye level to the laptop or computer screen has to be properly adjusted so that you can work at ease. That's very, very important. And I always recommend for people who are working in the long-term sitting job, they should have arm rest, because that gives a good support to you. You're not slouching, or you're not slouching working. They call text neck syndrome or crouching. When they get up, their body becomes little, and you adapt to these postures. And you see a lot of youngsters, they're walking with crouches. They are not sitting standard, natural, what you're supposed to sit. And they are the postural backaches or neck pains which are increasing by the day.
Sir, as we had discussed this in the last video as well, IT is also a very stressful job. Have you ever seen people because of that having the back pain and neck pain?
Yeah. I have a lot of examples. One patient was a young guy who worked for 8-9 years in IT in Pune itself, came to me one day and told me, doctor, I have taken a sabbatical, and I am probably, right now I am on sabbatical, but I want to leave my job. I want to go abroad. He wanted to go to Australia to study something different. He wanted to quit the job because this pain has become chronic. I am not getting better. I know I've met a couple of doctors. They told me I don't need surgery, but I don't need surgery. I know even if someone does my surgery, I'm okay, but I don't want this pain.
Right.
So he was that patient in between where he was frustrated with the sitting job, constantly getting pain, not being able to perform or do sports activity, or he wanted to do cycling or any marathons his friends used to do. He couldn't do that, and that made him think that he wants to change the job, leave the IT company. I said, that's not the answer. You can stand on your back. There are various options. But he was very firm. No, I want to do something different. And that's an example. It's not that everyone does it. People get better.
Right.
people understand. And nowadays with this WhatsApp University and Wikipedia University, we have a lot of things which we are there on the mobile or our laptop screens, where we can actually learn proper ways to keep ourselves fit, and you don't need to do what this gentleman did.
Sir, as we always talk in the last are the prevention measures. Can you just tell us a very small prevention measures which our viewers can today apply to their day-to-day life and move ahead?
Most important is, I always tell my patients that it's not the chair or not the table, it's your back and your muscles needs to be good strength, with good strength. Because once they are good, you can adapt to most of the situation. But yes, ergonomic is very, very important. Always check your sitting profile, number one. Take breaks at 1.5 hours, maybe 5-10 minutes, just loiter around, walk around and stretch a little bit, because you are working for 8-10-12 hours, and that can cause a lot of fatigability. You feel better, drink water, that also helps to hydrate, keep yourself hydrated. Maybe you walk outside if you have an option of sunlight or daylight, some amount of daylight also you can get, that also will add up for your vitamin D. It's a natural thing and you will always feel better. These are simple things. But most important, you can do some amount of activity. If you can walk, simple thing and best thing is just walk outside your house, wherever you stay. That's the easy thing available. Anywhere you are going for your travel or work, you can do that. You can cycle, you can swim, you can do yoga, you can do lightweight exercises, whatever suits you. But you should do it regularly. You should do it religiously. You know, for a lot of people ask me, how many days should I do it? Whether I should do it 6 days, 7 days, 5 days, or alternate days. I think there is no perfect answer for this. But I think 5 to 6 days is a good exercise or regularity. 1 or 2 days you can take it easy. Whichever you're working more, you can definitely skip it, or it will not cause you more harm.
Sir, are there any interesting stories you have about this back pain problem or IT problem which you
Quite a lot, but I can just remember recent one.
Yeah.
One husband and wife, they were coming to me for around 4 to 6 months, and we had treated her for muscle pain, neck pain, and after maybe 2-3 months she did some physio locally, and then again she came back for neck pain, and then they went back to their hometown. Again they took some treatment there, and they again came back. And when they came back to me, the husband told me, "Ki, Dr. Saab, do something for me, because whenever I see my wife, I start getting neck pain." So, that's like, this is not something which is funny, but he was very serious. Whenever he used to look at his wife, he used to get neck pain. There was no structural or mechanical problem for him, but seeing her suffering so much was something he was not accepting, and he wanted to know about it.
Which one of the factor was stress?
Probably yes, yeah.
Thank you so much for that.